We welcome you to our module Artificial Openings and Tracheostomy Status, HCC 188 and 82 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of artificial openings for feeding and elimination and tracheostomy status. At the end of this module, the learner will be able to note the different HCC categories that fall under artificial openings. Identify the different procedures that require artificial openings for feeding and elimination. Review the example of the assessment and plan for artificial opening-related encounters. Identify the exceptions that change the ICD-10 codes pertaining to artificial openings. Artificial opening for feeding and elimination is used when patients are unable to take adequate nutrition by mouth, or if the small intestine has to be removed by a surgical operation and is unable to absorb nutrients from their food. Artificial feeding may be required when the patient is in a coma, suffers a paralysis attack during which the throat muscles prevent normal swallowing, or develops a severe infection. Similarly, artificial tubes for elimination are also used to restricted body movements caused by coma and paralysis. Any artificial opening currently being utilized for feeding or elimination of bodily wastes including urine, feces and CO2 is considered under this HCC. Let's look at the various procedures where artificial openings are utilized. Tracheostomy. It is an operative procedure that creates a surgical airway in the cervical trachea. The air passage helps the patient breathe when the usual route is impaired or obstructed. Gastrostomy. In this procedure, a gastrostomy tube is placed in the stomach of the patient for nutrition support. There are cases when the patient is unable to eat or drink properly. This may be due to a blockage in the esophagus or a stroke. Ileostomy. Ileostomy is the procedure to let stool exit the body when the intestines are too damaged, inflamed, or injured for stool to come out of the rectum normally. It can be due to cancer, Crohn's disease or ulcer-related conditions. Colostomy. It is an operative procedure that makes a temporary or permanent opening called stoma. Stoma is the pathway from the small intestine to the outside of the abdomen. It aids in solid wastes and gas to exit the body without passing through the rectum. Cystostomy. It is the general term for the surgical creation of an opening into the bladder, to help drain it. A catheter is inserted which leads out of the lower abdomen. And lastly, urostomy. It is the procedure where an opening is created in the abdominal wall to create a passage for the urine to pass. It is performed when the bladder is either not functioning or has to be removed. This can be due to bladder cancer, spinal cord injuries or chronic infection. During the physical examination of the patient, report the presence of stoma, and/or the apparatus inserted in the body. However, once the stoma is closed, the status after removal of the tube, or other apparatus, is no longer coded. The document should state the presence of an opening and its status as long as it is in use. Let's look at the different HCC categories and ICD-10 codes considered for artificial openings. The code category is Z93. And the ICD-10 code for tracheostomy status is Z93.0. The HCC category being 82. The code for gastrostomy status is Z93.1. And the HCC is 188. The code for ileostomy status is Z93.2. And the HCC is 188. For colostomy, the ICD-10 code is Z93.3 and the HCC is 188. For other artificial openings of gastrointestinal tract status, the code is Z93.4. And the HCC category is 188. When the condition is unspecified cystostomy, the code is Z93.50. And the HCC is 188. For other cystostomy status, the ICD-10 code is Z93.59. And HCC is 188. For other artificial openings of urinary tract infection, the code is Z93.6. And the HCC is 188. And lastly, for other artificial opening status, the ICD-10 code is Z93.8. And the HCC is 188. While coding for artificial openings, a code category Z43 is also referred to. It includes closure for openings, reforming openings, removal of the catheter from opening and toilet or cleansing of opening. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of 2 progress notes. First with the colostomy status, and second with the tracheostomy status. Patient name: William Peterson. Date of service: November 25, 2019. Date of birth: February 28, 1944. Assessment and plan. Colostomy status. Colostomy continues to function without difficulties and the patient is independent with its care. Patient name: Aaron Paul. Date of service: April 26, 2019. Date of birth: November 29, 1955. Assessment and plan. Tracheostomy status. Tracheostomy stoma continues patent. Clean and dry without complication at this time. Continue to monitor for any skin or respiratory complications. Exceptions. Chances are that some complications may arise when dealing with complicated procedures involving artificial openings. When there are tracheostomy complications, such as hemorrhage or infection in stoma, the category J95.0 is used, which falls in the HCC category 82. For complications of artificial openings of the digestive system, the category K94 is referred to, the HCC for which is 188. For complications of stoma of urinary tract, the category used is N99.5, the HCC being 176. Lastly, for cases where external devices like prosthetics are used, the codes are chosen from categories C44, Z45 and Z46. We have reached the end of our short refresher course on artificial openings for feeding and elimination and tracheostomy status. We gave you a short introduction to artificial opening, discussed the procedures where it is used, identified the specific codes and HCC categories pertaining to those procedures, the assessment and plan for artificial openings, and finally recorded the exceptional cases which are to be kept in mind while coding for artificial openings. Thank you for joining us.